Okay, so we are now recording. So what I am going to do is welcome everybody that is joining us to this week in Shorr Solutions, the webinar. I am your moderator, Mara Shorr. I am one half of the Shorr Solutions partnership. The other half of the partners is Jay Shorr, depending on where he is in the Brady Bunch screen. He may be this way, he may be this way, but he is the smiling gentleman pointing as well. So Jay is our founding partner with Shorr Solutions, and as you know, we are a practice management group and really amazing consulting firm, if we do say so ourselves. We work with practices across the United States in the aesthetic arena. We have tagged in this week one of our colleagues who we really love working with and is just one of our go-to legal sources. Brad Adatto is a partner with ByrdAdatto. So wave on there, Brad. And so Brad is with, like I said, he's with ByrdAdatto based in Texas, and they specialize in healthcare law. We have so many mutual clients, and quite honestly, the thing that we are really going to dig into with this particular conversation are the topics related to COVID, but what happens when you as the provider, another provider in your practice, a patient, a provider's family member, etc., gets COVID. Now, the reason that we're dealing with this is we have clients across the country, and quite honestly, this is a question we had 3 separate times last week alone. We know that practices are struggling. So with that, some housekeeping items, and then I am going to turn this over to Jay, and you will see my video disappear. What I would say is make sure everybody is on mute, which you should be automatically. If you have any questions, I really encourage you to go into the chat box or go into the Q&A box and type in those questions that you have. We're either going to be able to answer them as we go and incorporate them into the conversation, or we do have time particularly reserved for Q&A at the end because we know y'all have some burning questions. So with that, I really encourage you to send those notes and messages. Thank you so much. I am going to turn off my video and you will see me go away in 3, 2, 1. I'm out.
We're live here. Okay. So welcome, Brad. And thank you. As I've been told, we sometimes should refer to you as ByrdAdatto. All right. I laugh about it as we share multiple clients throughout the United States, you on the legal side and us on the business management marketing side. And we continue to speak and communicate constantly. You know, we are colleagues at multiple conferences. And as, you know, the days go by, we day by day get these cancellation letters. I just got the cancellation letter today that the AAF-PRS conference I was looking forward to in Boston has gone virtual. And I don't want to call one conference out versus another as they're going, canceling and things like that because of COVID. But truly, we love having you as a trusted resource of one of our attorney go-tos, you know, your firm and a couple of the other firms out there. And lately, we have been communicating. We watch all of your videos and you're seeing ours, and we follow one another on social media and things like that. And this is a time, I know we're so tired of the term the new normal, and I stopped using the new normal because it is the normal for now. It's no longer new normal. And I paraphrase that similar to that of 9/11. You know, when you had to start taking shoes off and belts off and opening laptop cases, and the people today don't know of that as a new normal. We still look at that as current events, all right? But they're looking at that as that's just the way it is. So as we get into COVID, Corona, this virus, this pandemic, we have so many questions, and quite honestly, I'm full of opinions. And that's all I really can share until I hear from legal people and professionals like yourself. If you want to know about the P&L side of it, I'll tell you. If you want to know it from the operational side, I'll share it with you. If you want the legal opinion, I say, let me get back to you. And then that's when the emails between us all go back and forth. Now, I have a couple of questions, and really the idea of Shorr Solutions, the webinar, is to bring professionals and guests like you as one of the trusted resources in healthcare. And what I want to do is ask them questions and then just have some mutual dialogue between us, because I don't know the answers. We have many clients in the state of Texas, where you are based, and you handle way more than just Texas. But I'm going to go through a series of questions. It'll just be a dialogue between you and I, back and forth. And then we can open it up to the audience for Q&A, because everybody has questions. So my first question to you is, outside of the medical portion, what happens if a provider gets COVID? Because we just had one of our clients came down with COVID, and he calls and he says, what do I do? If you could share with me what you should do practice wise, and then what you should do staff wise, and then what you should do patient wise. And that's going to lead me into another series of questions.
And I have like 2 hours to answer that question, right?
We've got about 42 minutes.
Well, look, I mean, this is the fun part about my job of recently. It used to be laws were developed, and eventually we go to somewhere else where the administrative body would kind of massage it, and all the different places would say, no, this doesn't work, or this doesn't work. And then eventually us, the attorneys, would be able to advise clients as to this is the appropriate way to handle stuff. But since March, everything's been thrown out the window, where laws are passed and enforced, kinda, and then we're doing afterwards is chasing how the enforcement agency is going to enforce these rules. And so with COVID, that's been an absolute game changer, because we'll have federal rules. So again, you're answering your question. On the federal side, we have a bunch of different bodies that I have to deal with. The CDC, which is the Centers for Disease Control, right? I have OSHA, Occupation Safety and Health Administration. I have the OCR, which is the Office of Civil Rights with HHS. And then I have the Labor Department, because they have a host of rules. So that's just a federal piece of it, right? Then I have state. So depending on our state, each state has different requirements, but especially, and this is just on a provider, as to how to handle that provider. I have state health departments I got to deal with. I have county health departments. And then finally, especially if the provider happens to be a physician, I have medical board rules. So those all three play at some level when I'm doing that. And I'm assuming the provider most likely does not have the last piece, which is they don't have any rules yet for their organization, their medical practice, because a lot of medical practice will have employee handbooks or policies and procedure manual. But I can tell you right now, the vast majority of our clients, and I'm sure your clients, haven't really gotten around to getting this policy completed. They might now be saying, like, I know some of my clients just adopted, will follow what the CDC says, and that's their policy, but they don't even know what that means, because the CDC's giving us different guidelines. So big, broad picture is that's how I'm going to answer your question, but I can start diving deeper as to which agency goes into. And that's the piece, is that, you know, you're as a medical practitioner, you're going to be subject to all of these. And if you're not in the medical side, and I know that all your clients are on that medical side, we'd have less rules to discuss. But that's our big item of all the different pieces that we're going to touch. And you can tell me if you want me to start noticing one and work my way through it, or we can go to each federal or state or medical board.
I'll break it down a little bit piece at a time, because, you know, people say to me, well, who rules? Is it federal? Is it state? Is it my medical board? Is it county? Is it city?
Great question.
And I said, well, the first thing you really need to worry about is your license. Okay.
Good answer.
That's the first thing. And then we'll get through to the rest. So let me just ask, who rules?
Yeah. So right now, the CDC doesn't rule. So that's the good thing. The federal government does not rule you as a medical practitioner. So the CDC right now has a ton of guidelines, which they're then helping giving to the states, and then the states are digesting them. But, you know, you worked really hard to get licensed, right? Most of your providers in the sense of, hey, I went through med school or whatever, nurse became a nurse practitioner, whatever it ends up being. And I worked really hard to do that. And so I have to abide by that licensing board. Right now, most of the medical boards, they really haven't issued any rules as if I'm a provider and I get COVID, what do I have to do towards the medical board? And what most of the medical boards will point to is that the standard rules, which are very subjective, but that's the rules, is, hey, you as a practitioner, no matter what, your Medical Practice Act is going to say, my behavior, I'm not going to expose patients to unnecessary risk or harm. So that unnecessary risk or harm goes in many different ways, right? During a pandemic, what kind of surgeries are you performing on them? What type of consents are they executing? But if I know I'm sick, I probably shouldn't be around that particular person. Following that, am I acting within the standard of care? If I'm actually rendering services while I know myself or a staff member has, again, this is a positive case we're talking about, a positive. And finally, this is the catch-all one that every single medical board loves, because if I can't figure out what to do with you, Jay, and I really just don't like you, and I'm just going to go after you, I'm going to say you're acting unprofessionally and unethically. And I cannot tell you how many times, for our perspective, we've seen the medical board just put their hands up and go, yeah, I'm not sure what rule they're violating, but we think what they're doing is unethical and unprofessional. So that's just the medical board, how they look at it right now. So I have not seen one medical board say, hey, Dr. J, now that you have COVID, you need to notify us, the medical board, that you have it. So that hasn't happened yet. But we do know that those are the rules that we always advise our clients on, just in general, as it relates to your license. And you're right, they tend to be the ones you want to worry about. But to kind of add a little juice to it is your state can then issue fines to you. And for so the second part of this whole equation, especially we're working our way from the medical board to who has authority over me, is it could either be your actual state. So your governor may have issued an executive order saying that you as a medical provider must notify the county or the state or whatever, or the governor has given authority to your county to, again, notify the county. So right now, as a medical provider, we're protecting our license first, but now if I test positive, I most likely, in some states, have a reporting requirement to that county that I, as a medical provider, have tested positive. And I have to either report it at the county health level or the state health level, or both.
Now, some of our clients are medical spa providers, cosmetic surgeons, non-surgical, and many of our clients are true surgeons in the sense of the word, surgeons that work in level 2, level 3 ORs. Now, for the sake of this, let's say let's break this down too. The surgeon or the doctor in the office tests positive. What is the ruling for when and if they should notify, either in contact tracing, those patients which they have seen in how long a period of time, those people that have been with them, for example, their staff, their OR nurse, their circulator, self-quarantining 14 days, and then paying for 10, which is going to get into another question as we go a little bit further. But should the practice shut down? Should the staff be quarantined if there is a known positive case in the office?
So let's break it down. There's two actually different rules that come into place. The first question is, if I am the medical provider, I'm the physician and I get it, what am I supposed to do? Well, the first thing you're supposed to do, obviously, is quarantine yourself. The CDC says at the very minimum, you should quarantine yourself for 14 days after your last symptom has gone away. And so again, there's different ways the CDC give guidelines. And the reason I'm gonna do it with the CDC is many of the states have adopted, the CDC is 10 days. Many of the states have adopted that or added a couple of days. So that's why you see some of these things with the CDC. They talk about 10 days, but a lot of the states have adopted a 14-day window. So it's somewhere between 10 and 14 days. You as a provider, you need to quarantine yourself. And then, and during that time frame, once your symptoms stop, that's when the clock actually starts. And there's a whole bunch of definitions I could bore y'all with about what they mean by that, but that means like your fever broke and it wasn't because you were taking Tylenol, right? You know, you stop coughing, and so whatever all those symptoms were, you're done with them, and then the clock starts ticking, and that's when you start looking at it. Or you tested positive, but you've never had any fever or anything else like that. They say, well, all right, I'll tell you what, if you've tested positive, you don't show any signs of symptoms, we still would rather you go and self-quarantine. But if you go and get 2 tests that are FDA approved, there's a bunch of rules there, back to back, and it's within a less than a 24-hour period, and it's been verified, then you're no longer asymptomatic, then you could actually go back to work. So again,
It doesn't matter whether it's an oral or a nasal. You're just saying as long as it's FDA approved. Is that what you're saying?
yes, there's a certain FDA test that, this is again from the CDC's version.
Correct.
I will tell you, based on experience that I've had with my clients, a lot of states are still struggling with the ability to even, number one, so one of my plastic surgeons, he felt like he had it. He ended up eventually getting in. So it was 2 or 3 days in before he could actually get in, got tested. And then it took 2 or 3 more days before he actually turned out that he was actually positive, which he thought he was. But now we're talking, he's already 5 days into the time frame. And believe it or not, on the 5th day is when he actually felt fine again. So then he's like, okay, do I then go try to get tested again, wait for the 5 or 6 or 7 days to get it, or do I just ride it out until the time frame's over with my clock starting tomorrow? And so he ended up riding it out because he's like, the test is pretty miserable. And so he didn't see a reason to go back to back to go get it tested. And he's actually treating patients again now. But that was how he ended up playing it out as far as it worked for him.
Right. So let's give a scenario here for a second.
Okay.
So now the OR nurse, she has a family member, her husband, who she has come in close contact with, and or the children. And then the spouse or family member, be that as it may, tests positive, and it is a known, you know, it's a FDA approved test, and they are positive. So now we tell that the employee, staff member who has tested positive, has come in close contact with that family member, has to self-quarantine for the 14 days. And under that guidelines, we have to pay them for 80 hours, or let's just say 10 days. You know, if we want to break it down at 8 hours a day, 5 days a week, 10 days. Now, understanding all of that, when they come back, what happens, because now I'm going to break this down into 2 questions. What happens if another family member tests positive and then they have to go back out again? Because this can keep going on and on and on. And what are our requirements as a practice owner to continue to keep paying these people?
So the answer your first part of that equation is, again, that goes back to the person would have to self-quarantine. There's a whole bunch of cleanliness that we would do with their particular office, depending on when did it start. You as the employer under OSHA, so this goes back to something I think you asked earlier, but is you as the employer under OSHA. So those who are not familiar with OSHA, hopefully you are, that typically your job under OSHA as an employer is to keep your team safe, right? Occupational and Safety and Health Administration is all about the staff. And so part of that is you're protecting your staff. And in a lot of people, especially if they have needles, if they have a book that they have to record, or something like sticks themselves, it's called the stick book. A lot of people call it the stick book. Anyway, in OSHA in May said, hey, we're adding to the stick book, meaning that when you have an injury, a job-related injury, you need to start recording how did that person get it. You need to take a reasonable investigation as to, did they get it from someone else? They were out with their family member, the family member gave it to them, or is it someone that from your staff gave it to them, or a patient gave it to them? And so they're actually requiring you to conduct a reasonable investigation of confirming where it goes and then writing it in the book. And this just came out in May, so it's, again, going back to what I said, it's relatively new. We're not exactly sure all the rules surrounding it, but this is where when they start talking about contact tracing, about who should you notify. Well, under OSHA, up until OSHA came out with this rule, you actually had no legal requirement to be notifying your patients or your staff. Now, based on OSHA, you're supposed to conduct an investigation. Well, how are you supposed to conduct that investigation without actually going through this process of, and most likely trying to notify people as to who came in contact, how's that patient doing, and that OSHA basically opened up that investigation piece.
But in this particular situation, you know how the person got it.
And so that goes back to the reasonableness of the investigation. If you can confirm, hey, she got it before she came in, we know that she got it before she came in, no one else in the office or patients have reported it, so we're going to make you self-quarantine. The second part of your question, though, is what about if, okay, that first person now is healthy, but now, the son has it. So what happens now? Can my RN come back in if the son has it? And that's the part that's unknown, because they still don't understand how these antibodies work. So let's just pretend I have the antibodies now. And once I have the antibodies, I've heard anything from, oh, you're good for 12 months to 3 months, or you're not, because you may end up getting again.
I challenge that. I can't get a good answer from either Sanjay Gupta, Rob Redfield, or Anthony Fauci.
Yeah. And so that's the problem that we're faced with is, what do we do? Do we require that person to get tested back to back again and confirm that they don't have it, or we continue to have them sit out?
But if they do, if we've already used the 10-day pay, 80-hour, and they come back, and then somebody else in the family gets it, unknown about antibody, we'll stay out of the medical portion of that for now. Do we have to pay them again? And how long does this go on?
Awesome question. So that jumps us into the labor world. So remember I had said there's different people that we have to answer to. So on the labor, Department of Labor, there is, so actually the first thing you would look to is your policy. You may have a PTO policy or vacation policy where they can then use up all their PTO time or vacation or sick, whatever it is. So let's just pretend this person has used up all their time. So that's the first thing we look to. Does this person have it, and can they use it? Then the next thing we look at, are they salaried employee or hourly employees, because that makes a difference about how we would end up compensating while they're not there. And then finally going to where I think you want to go, which is the FMLA, so Family Medical Leave Act. How does that apply under these circumstances, especially in light of, if you remember, in early March, well, it was late March, early April-ish is when the Families First Corona Response Act came out. That, the government, they love their names, but basically that is an add-on to the FMLA. And what it did is it added a chunk in there about how people qualify for additional PTO and how you would have to compensate them if they got sick, or their child got sick, or their child had to become. And there's a whole laundry list of things. I'm going to stop right there and not go into it, because if you are a medical provider, and this definition is ginormous, the Families First Coronavirus Response Act does not apply to you. Now, there's also, let's just pretend someone's listening who is not a medical provider, but you have less than 50 employees. It's a process you can go in this internally to say, hey, that's going to be too burdensome, I'm not going to do it. But all my medical providers, I told them, if you want to use the act, great, but by statute, as a medical provider, again, it's a huge term. And when we went back and looked at this, when it first came, when the Labor Department gave some guidance, it includes everyone. And when I mean that, it's not just the doctors, it's anyone who works for that office. It could actually be vendors that work with medical providers. The government wanted to make sure that they, for whatever reason, they were very inclusive or a very broad definition of who those people are. So once this person uses up their PTO, consistent with your policy, unless your state has some other additional vacation or other sick pay, or they have passed some of their own version of, which I have not seen yet, but it wouldn't surprise me that states would start catching up to this, then you would stop paying them if you want to. So that becomes it's a must versus may at that point.
So can I confirm actually that if you are a medical provider, you do not have to pay the 80 hours under 50 employees?
Correct. If they've already used up everything else and the state doesn't have some other requirement.
Right. All right. So if the patient now comes in and we find out that we have treated a patient and they test positive, What is the statute for the practice as far as anybody in the office that may have had any aerosol contact with that patient? Hopefully, we're supposed to be wearing masks anyway. All right. And there's a time limit of how much time did you spend with that patient in the office? What is the quarantine ruling that we did a surgery on a patient on a Monday? Now, on Wednesday, they said they're running a fever, which may not have been subject in January or February to anything that was very subjective to you better get a test because you may have a slight infection or you may have an elevated fever. But now it's, look, if you have a fever, you have taken your Tylenol, go take a test, the patient turns positive. Now, we've done surgery on this patient. What, as a practice, are our responsibilities?
So you said a couple of things that were important in that. Number one, okay, let's assume
We did
that
the temperature test. We did the H&P prior to the surgery. All right.
Okay.
To make sure we had our ducks in a row. We did the pre-op. Then the patient comes in. We do our pre-op the morning of the surgery. There is no temperature. We've done everything. We don't find anything to be strange. We perform the surgery, and then several days later, the patient goes and gets a test and then tests positive.
So if it's a surgery, we're going to assume that the surgeon actually was wearing proper PPE. So that's the first thing we're going to do. The person was asymptomatic at the time, but it turns out they may have been positive, which has actually happened to several of my surgeons where the test came back after, or one of my neurosurgeon had to do the surgery, but came back positive while doing the surgery. And, a lot of the surgeons I spoke with on this particular issue, they said, look, we're used to being around blood and the fact that, there's something in there that we can get in trouble with. So there's 2 or 3 different ways in which we can protect ourselves, right? And no matter what, it comes back to mask and good hand hygiene. A lot of times now with surgeons, even if they are not wearing a respirator, which is a lot of the anesthesiologist clients of mine will wear respirators because they're dealing with the mouth and they'll put a face shield on. But if your surgeon, if you're wearing a mask, a face mask now, so a face mask, don't think of a cloth mask. We're talking about some FDA approved surgical mask or procedure mask. There's a whole dental mask. There's a whole list of them, but all of them helping stop the blood getting your face. Now, if the person was not wearing a mask, so I'm assuming if they're during surgery, they're not wearing a mask, you then have to have a shield in front of your face. So if I had a surgical mask on and a shield in front of my face because their mouth was exposed, then actually at that moment in time, it doesn't matter how long I spent with them, I am safe, and I don't have any reporting requirements to my team. I can obviously try to tell them I have HIPAA issues I got to worry about, but I have no other additional things I have to do. I don't have to self-quarantine because what the government said is, hey, you've gone through the process of protecting yourself, and we believe that is sufficient enough for you to continue to treat patients, because I realize it's, the assumption is you got to assume everybody has it. And so that's why, we recommend for everyone that when someone comes in, you have a whole process and everyone's wearing masks again, and that the patient is wearing a mask. I can't tell you how many times I've had the story of, patients wearing a mask, the doctor's wearing a mask. Turns out the patient ended up turning out to have COVID, but knowing that their team ended up getting, the doctor didn't get it because they're minimizing the time that they can spend with the patient. So telemedicine is huge. So I might be in the room for less than 15 minutes and I'm in, I'm out. If I'm taking the mask off, I'm doing it very quickly and making sure I'm very precise, or making sure I have a mask on. So these are all the kind of things that if you had all these things in place beforehand, then you're safe. If none of those things I just described to you were happening, then we're going back to the beginning of the time where I say, well, now you got to get tested. So you've been exposed, right? That was one way thing. You can start testing, or you have to self-quarantine, or you self-quarantine while you wait for the test to come back, which is why PPE is so important right now.
All right. So how do you treat this now positive patient post-operatively? Do you risk the staff exposures to this known positive? Do you treat them in the emergency room? We've just spoken about full PPE, and as long as we have minimized our risk, and whether or not we've used the regular masks and we've used the face shields, we've had, minimized aerosol, exposure, 15 minutes. How do we now treat this patient?
So this just goes back to our medical board rules, right? Our medical board rules say that with the standard of care, I have to continue to treat this person. I can't just because I believe that I had one doctor telling me this. He's like, look, we're in the practice of medicine, and yes, we're gonna expose ourselves to harm every day when a patient comes in, no matter what it is. And we have to be, if you're not willing to do that, you're in the wrong business as it is.
Right.
And he's, and when you talk to surgeons about this, a lot of them are like, this is not a big deal. Like they're like, I've operated on people with AIDS, or I've operated on people with other issues. That's why we scrub in. That's why I have good hand hygiene and wear masks. And so, yes, you still have a requirement to treat this person. If you fail to continue as post-care, that would be consistent, which was required within the standard of care, you can absolutely be brought up with your medical board. The excuse of this person has COVID is not a valid excuse to the medical board. Now, what would you do differently with that individual? If they had to come back to your office and it was within the same time frame, yeah, what you would do is you would want to make sure that you have a special room that you're putting that one person in. You're going to minimize the time frame in which they come in. You're probably going to meet them at the door and walk them right in there, and everyone's wearing shields and masks. I mean, there's a lot of things that you can do, but you just have to be very conscious of, hey, this is continuing treatment. And again, it's different than, and to be clear, Jay, we're talking about surgery. We're not talking about like our med spa clients where, hey, I'm up for another Botox, or, I'm up for another, laser at this point. I want to come in. And by the way, I'm COVID positive, so I need to have it. It's like, no. That's different. That's elective, right? Elective surgery, and you've moved past it. So if I hurt my ankle and I wanted to get surgery and I call them up and they say, great. And they tested me. So I know this story very well. Someone I know whose son was getting surgery. And they said, we're going to test them. If it comes back positive, we're going to make you wait 14 days before we'll do it again. So they were doing the test beforehand, obviously, and they make them wait the 24 hours. They're supposed to stay, obviously away from anyone during that time frame. If the test comes back positive, they'd wait 14 days. Because I haven't started the surgery. But the moment I start that surgery and cut on that person, start getting in there, they're now my patients. To bring them back to the level I'm supposed to bring them at the same level of the standard of care.
True and agreed, so that you don't have anything brought up to you, I guess, of patient abandonment. But is it your recommendation that you continue to treat them in the office, or do you possibly request to treat them elsewhere? Because now let's bring up, that's a very good point. Now we bring up staffing issues. Because now the staff is a little bit on the freaked out side. Even though they are using PPE, they're very uncomfortable being exposed to that patient.
Yes, and so many of my clients, or when they're reopening, one of my clients ended up spending over 4.5 hours on a call with his staff that he's been with it for over 20 years, who are very nervous about coming in and their exposure level. And he was trying to explain to them the same thing I'm explaining to you. Hey, we're gonna have PPE. We're gonna be very careful. We're gonna have disinfection. We're gonna be cleaning the rooms correctly. But going back to your question is, if I don't allow this patient to come in, and I say I'll meet you at the Starbucks, or I'll meet you at your house. Well, maybe the house that it's within the standard of care, right? Because if you remember, when you're treating a person, you have to treat them at the same standard of care as if you're treating them in your office. It has to be the same sterility. So you can't just say, I refuse to treat you here. Now, you might say, you know what? I just talked to the landlord. There's 2 empty offices down the hall. Let's go see if we can use that space. It's cleanliness. It meets the same standards I already need. And that way, this one person, it's kind of like, if it's been a while since you had to take your kid to the pediatrician. But there's a sick door you walk through, and there's a healthy door you walk through. And so the pediatricians have been doing this forever, where they have the 2 different doors. And most of our providers on the aesthetic side are not going to have sick doors and healthy doors, right? Because they're generally speaking treating healthy patients. But on the aesthetic side, yeah, they would have to come back to your office, and you would have to be, again, if that's consistent with where their follow-up checkup is or whatever else it is. So yes, they could go to their house if they wanted to, and so long as they met those same criteria.
Now, knowing that there may have been a COVID, all right, because if somebody is going to come, and most of the times you're representing the defendant, not the plaintiff, all right, and the defendant meaning our clients, the doctor. So right now, for example, in the state of California, all of the Board of Cosmetology is preventing those licensed estheticians from performing any facials and things like that, even in the med spa. Now, even though the state says it's okay, the Board of Cosmetology has now come down and said they have the right to revoke the esthetician's license if they perform any non-essential treatments. Now, knowing that a patient can't, if you're doing a facial on somebody, my opinion is don't do it. All right. Even in the times that you're allowed to do it, if there's been any type of exposure and the patient comes down with COVID and now they hire an attorney and now there's the plaintiff's attorney. Through discovery, they're going to look and see everywhere that this person has been for potential exposure. How do you advise our mutual client to handle this? My opinion is hold off on those types of treatments to minimize exposure. However, my answer is, Jay, this is our living.
Yeah. And this is the really tough spot because you're just questioning me. It's the same thing that's happened to surgeons in San Francisco, surgeons here in the Dallas-Fort Worth area, where in Dallas at least, elective surgery has been stopped again. And so it goes back to the state says I'm fine. Well, that means I'm not going to get fined or arrested depending on the rules. But my licensing board says if I do it, they'll revoke my license. So remember the first thing we started with was the boards, medical board, the nursing board or cosmetology board. So now you're subjecting your license. So then let's fast forward to I rendered a service I was not allowed to do by my boards. Would a plaintiff attorney use that against me? Oh, sure. Why? Well, of course they would. And then they'd say, clearly you exposed my client to this particular COVID. And again, going back to in California, Texas, and other states, anyone can get sued for anything. And COVID's going to unfortunately open up a whole bunch of new malpractice type claims. And so as a person rendering medical services, now the aesthetic side of that, it can be obviously fall in a little bit different direction because of it's typically not considered medical, but will that prevent a plaintiff attorney from trying to say, well, but for the fact you gave this person a facial, they might not have gotten it? Probably. There's a great case of, forgive me, I can't remember if it's Missouri or Kansas right now, where people giving haircuts, the two ladies giving haircuts both had COVID and exposed like 120 people to COVID. Now, what happened in that case, all the people that they gave haircuts had to wear masks. Two people giving haircuts gave masks, and not one person so far has gotten COVID. That happened well past, so they would have gotten it by now. So the point is, if you are in a state that allows you to give a facial, best you can, what should you do? Well, the same description I just said that probably is mask up, wear a shield, goggles, or whatever it is, so that since that person's exposed, that you can at least at the very minimum minimize that you can say that you were the one that gave it to them because you put yourself in a position where you could legally do it in your state and your boards allowed you to do it. But I protected myself to make sure that it couldn't have been me that actually gave it to the person.
Right.
Again,
the differentiation between a civil and a criminal infraction is the state guidelines expressly stated you cannot, versus you took it upon yourself to do it, even though you were allowed to do it, and actually gave more exposure to that liability, where the plaintiff's attorney now comes back and says, if for not having done that, you would not have put that person in jeopardy.
And what they would say on the cosmetology side, they say, hey, your board thinks that this exposure is too high, and therefore you're committing malpractice by not following your board's rules. And that's how they would use it against you. And then they would use it like there's a lady here in the Dallas-Fort Worth area that was arrested for giving haircuts. There's a tattoo artist, I think it was in North Carolina, that got arrested for who opened up his tattoo shop. So all those people is if you are doing that and you're outside the scope of what your state says, you definitely want to make sure that the person, I mean, we're talking about elective services, has a very strong consent, that they're consenting. They understand there's a pandemic going on. They understand they could wait. I don't know when the pandemic's gonna be over, but they have these choices and they chose to do this, and they understand that by getting your skin, you know, whatever, how you would describe it, exposed, that this ups the ante. All those are the kind of things that you want to start thinking about differently, like any other risk assessment, and having that person understand that, yeah, I'll take that risk. I want to get that tattoo, or I'll take that risk because I want to get my hair cut, or whatever it is ends up being.
I want to ask your opinion on something, because in the age of social media, you know, sometimes people do the craziest things when it's very innocent, not realizing that what potential exposure they put themselves into. I'll give you a hypothetical that a staff member is under this paid medical leave. All right. Now, doesn't matter whether it's the 2 week plus 10 week under the FMLA, or they've been given the 80 hours of leave because they were supposed to have been self-quarantined. And now, through the age of social media, this person then takes pictures of themselves in a mall.
Hmm.
Can you, as the practice, retract that pay because you violated the self-quarantine rule versus the employees saying to you, well, I wasn't working at those hours anyway?
A great question. I have not seen that brought up. What I have seen was when people are typically injured and they're not, and they're supposed to be, you know, injured, and then it turns out they're fine. This is a situation typically if someone's going back to, they had COVID, their exposure. The reason why you're self-quarantining is so that you can show that you cleared the symptoms. But as an employer, you're trying to prevent that particular individual from exposing to your patients or to your other employees. Now, the real question is whether at that point, have they violated some policy that you had in your handbook, and by saying, hey, if you're out on sick leave, and again, this just goes back to handbooks haven't probably caught up to it, or you're out because of the CDC rules, you know, and you violate now the CDC rules, and now you've actually exposed yourself potentially again. We're going to require you to get tested, and if the test comes back positive or negative, depending on how that reacts, we'll deal with you then. I think, you know, the last thing is, Jay, is whether or not, you know, this is the good, bad, or indifferent, how you want to deal with that staff person in general, because the trust level may have gone down, that they might have just been playing hooky on you.
For sure. Now, I don't know if you've ever heard of this one, but I come up with them all the time, dealing like you with people around the United States. We get hit with all of these questions. The person now is working from home because we're asking this person to do things at home if you're on a stay-at-home order, but through PPP, all right, we paid them. Now the person falls and gets hurt in their home while they're working. Are they subject and covered under workers' compensation regulation because they were on the clock when they fell in their own home?
I give you one better. What happens when they left their home to get in the car to drive to Starbucks to get coffee, but they already had punched in? It's very state dependent. And yes, the telecommuting policies that you have in place, and having people work from home is changing your insurance. It changes your processes, and it does expose you to other liability that you weren't anticipating. So yes, the answer is it could. You could be, if they slipped and fell. Now, obviously, the question would be whether or not you'd be held liable because you've never been in their house, you've never established it. But in some states that are more aggressive, they've said if you're going to have a telecommuting policy, you need to go to that person's house, confirm they have the right desk, the wires are tied up correctly, you know, et cetera. And again, is it reasonable to assume that during a pandemic, you should be having your teams, your IT teams going in and out of someone's home to confirm the meeting, and you thought it'd be temporarily? and you wouldn't have the insurance for it, yeah, it's reasonable, and you would expect the person done, absolutely. But does that mean that plaintiffs bar wouldn't try to do something like that? No, they actually have in other states, which is why a lot of the, I know some big hospital systems, their labor lawyers very well, and a lot after getting sued so many times, they said no more. We're bringing everyone back in house. Now we're back to it because we have to. So it's a state order or county order or city order. And then maybe the person then elects to stay home, but then you start, maybe that's going back to your, what does your telecommuting policy say? So does it say they're allowed to leave and drive a car while under the telecommuting policy? If so, they must check out. All those are the kind of things you start working your way through to making sure you have good policies to minimize your exposure.
All right, as we're getting ready to wrap up, look, I always like to challenge people. I love being number one at anything I do. Unfortunately, I live in Florida and we are number one. We talked about this earlier, but you're running a pretty close number 1 and 2 in Texas too. And we have clients in Arizona and they're not doing so well either. All right. So we don't know, as we say, I really want to be apolitical because I never want to get into the politics with this. I only want the health involved in this. As we're not out of phase 2, we're going back in some areas back into phase 1, whereas California and in Florida, I just heard that the mayor in Miami-Dade County may institute, and in Broward, a stay-at-home, not knowing what's going to be with opening the schools and not opening the schools. My concern will be they're running out of PPP money, all right, because I don't know that there will be a second wave of this. They're running out of EIDL money, from the SBA, and not knowing whether or not the children are going to be able to return. It creates a nightmare on the staff, mom or dad, all right? If there is a parent that is able to work from home, how do we say to the employee who tells us they can't come to work because they don't have childcare? How do we get into that argumentative or stay away from the argumentative situation, but your spouse is unemployed? Why can't they watch them? Because these are true scenarios that we run into.
So this goes back to the FMLA and the ADA, and this goes back to accommodation. You as an employer, you obviously should have that conversation with the individual, try to find a way to accommodate the individual. But if you can't accommodate them, again, for the healthcare providers, the second half of the FMLA plus, as they call it, does not apply to you anyway. So we're throwing that out the window. After you've tried to accommodate this particular person, there's only so much you can do. So one of my clients in California had a nurse injector. She wouldn't come in because she was too afraid of it. He tried to accommodate her, but at the end of the day, this person had to come in. But then you have the situation, well, this particular person can't come in because their children have to, they have young children and they can't leave the child at home. What do you do with that person? Eventually, unfortunately, some of my clients had to furlough those individuals because they need, if their office is open and services need to be rendered, after the person's used up their PTO, and assuming the plus does not apply, it's eventually, unfortunately, you either have to show up and work or you have to terminate the relationship. And it's awful because, like, I got young kids, and so I just got told in the city of Dallas that our schools aren't opening to September 7th. And that means my son who's been training for cross country, he's just found out that it may not even take now. So it's hard. And I'm not going to say this is an easy situation for anyone. And anyone who tells you otherwise is lying to you, because these are, I'm assuming most people like myself are close with their team. Their staff means a lot to them, and they don't ever want to see a situation where you tell the person, if you won't come in, I got to let you go. But at some point, there are situations where if you don't have the income, the PPP has been dried up, you've blowing through the whatever line of credit that you might have, you're going to start having to make difficult decisions. And unfortunately, I have a half a dozen clients now have filed for bankruptcy. Not all in the medical community, but it's happening, and it's awful. And these are good people, and no one anticipated this. at all. If you go back and look at any of our videos and at the end of 2019 and beginning of 2020, we were talking about ways to help build your success in 2020 and what kind of roadblocks would you face in the beginning of 2020. We never mentioned one of the roadblocks being a worldwide pandemic.
Yeah, I've actually had people ask me, can they hire us to help them go out of business? And I say, yes, because there are specific rules that you need to follow when you close your practice and what
Yeah.
you need to do with your charts and what you need to do to advise your patients. I call it business hospice. You know, I can help you give you a little bit more oxygen to sustain your business just a little bit longer. In closing, what would you tell a client or somebody that's not a client? You know, because we get people all the time calling us and asking for questions. And I'm not about to say, well, we don't represent you. I'm not going to give you any information. I'm not going to guide you legally. I'm not going to provide you with the management tool. But what would you tell somebody while they're going through this, that maybe the top 3 things that they need to do right now to stay out? Now, the reason I'm asking you this is to avoid a lawsuit, you know?
Yeah, and I'd say it's even not avoiding the lawsuits and avoiding an OSHA investigation, because the number of OSHA investigations are shot through the roof because staff are terrified and they're complaining like crazy. And so, you know, the number one thing you can do is educate. I mean, that's if you're not educating your patients, your staff, and yourself on what you need to do to protect yourself, you're behind the curve. And hopefully you're attending this because you're educating yourself. But that's one of the reasons why you know, we highly recommend following the CDC guidelines and the education of having good PPE, teaching your staff the donning and doffing of that PPE, making sure they have good hand hygiene. Look, there's nothing. I mean, I know these wonderful surgeons who've gotten it, so I'm not saying that you can do anything wrong. It's out there, and someone I was supposed to have lunch today with got COVID, so it's out there. So you know, you have to remember that COVID is something that we have to deal with, and assume every single patient that walks through your front door, or anyone you're treating, has it. So make sure they wear a mask. And so that by educating yourself, educating your staff, and then obviously educating the patients or your clientele of the expectations, that's going to help at least minimize all those risks that we're talking about. Because now we're talking about everything that happens after the fact, which is just the sucky part of running a business or being in a business right now during COVID. But those are the things that we can control. We can control that education. We can control how we treat our staff and making sure they have the right equipment. After that, we just have to kind of ride the roller coaster, see what happens.
Good. Right. Brad Adatto from ByrdAdatto, one of the founders and the senior partners with Michael Byrd and your associates. It has been an absolute pleasure. I can't give you the hug that we normally do, high fives and hugs inside the conference hall and in the meeting rooms as we follow one another or we lecture right after one another. It has been an honor to have you on Shorr Solutions, the webinar, as one of our trusted guests and professionals. How can somebody get in touch with you, Brad, and members of your firm when they go through this and need legal help?
Yeah, absolutely. And again, Jay, I always love catching up with you guys. So, and it was fun catching up with you for the webinar. But yes, and thank you again for having me on. So I always appreciate spending some time and educating anyone on this. And so for number one is, if you have questions afterwards that we didn't answer, just if you call our main number, 214-291-3200, and I think that might be one of those slides or on the brochures, or even email me at ByrdAdatto@ByrdAdatto. It's and just say, hey, I attended the Shorr Solutions. We'll be happy to spend about 15 minutes with you as an initial consult and kind of help answer, diagnose your issue and try to help you understand what we see. That doesn't always mean that we can resolve your issue, but that's, again, we obviously do a lot of stuff with you guys, so we'll be happy to help out your clientele, which sometimes is our clientele too. But any way that we can help your team, more than happy to do that. So, and I think if they don't have my information, I know you guys have it, so more than always happy to help.
and we are more than happy, Brad. As you know, we are more than happy to tag you in. So if you don't have Brad's information, I encourage you, our information is at the bottom of the screen. If you don't already have it, then I encourage you to visit our website, send us an email to info@Shorr Solutions. We are more than happy to pass you along to Brad. I am here for all of your housekeeping needs, which is why I am back to say I really, really encourage you check out shoresolutions.com/webinars. As you can see on the screen, that's where you can find all of our upcoming information on upcoming webinars. You could see we already have 1 to 2 more scheduled out. I also encourage you to check out Shorr Solutions, the podcast. We do have an episode with Brad on it. I think, Brad, you were our second episode. So if you loved what Brad had to say today, then go to Shorr Solutions, the podcast, wherever you listen to podcasts. You can listen to whether it is our latest episode featuring Angel Mitchell talking about Black Lives Matter and why representation matters to your patients, or you can go right and beeline it to either the episode where I spoke with Jay about how we founded Shorr Solutions, or when I spoke with Brad. I truly encourage you, keep learning. This is something that Jay has taught me from when I was a little girl. So for those of you that may not know, we're obviously father-daughter. So from the time I was a little girl, he always taught about education. So thank you so, so much. One thing I also want to make sure everybody knows is that Jay has asked 2 things of us today. And so number 1, there are several free offers that we're making available to you from Shorr Solutions. So if you're interested in one of these 3 free tongue twister offers, then I encourage you to touch base with us. And the other is that a member of our team is available if you have any additional questions after this. So whether that's myself, whether that's Jay, but Jay's asked that we make ourselves available, and we are happy to oblige our founding partner. So with that, thank you so much for joining today on Shorr Solutions, the webinar.
Bye.
Thank you, everybody.